Cancer is a tough topic, I guess, in any sense of treatment. But the truth is that we don't treat cancer. In fact, when, and I'm saying this as a provider, as a practitioner, when I had my clinic, we never treated cancer. Now, that's not to say that we didn't have patients that came in that had cancer, but our goal was not to treat cancer. It was to treat the patient, the person sitting in front of me. And, I've seen so many different cases and working with providers across the country and even home users that have been suffering because cancer is a sense of suffering. It's a body that's being depleted and your body is literally screaming out for help. And that can go across with multiple different disease processes. I think cancer is something that is a hot topic that not many people want to talk about. And for the most part, we've been, in a sense, I don't like to use the word brainwashed, but taught and possibly brainwashed that it's kind of, in a sense, a death sentence. And if it's not a death sentence, it's a sentence to only a couple tools, chemo and radiation, or just cutting something out. When in fact, I don't think that we get to the root as to why the cancer actually started in the first place. And I don't believe it's genetics. There's a tremendous amount of research that actually shows that it's not truly genetics. We all have good and bad genes. It's whether or not they get turned on or turned off. And I think it's the things that we do, because if it was truly genetics and say my mother had cancer, we'll say it's breast cancer, that doesn't mean that her daughter's going to have breast cancer necessarily, but we're told that it's going to happen. And so we are in this reactive state, just like our body becomes in a reactive state when we don't take care of it. And so then that produces basically this erratic conflict between our cells. And when our cells can't communicate and they can't detox and they can't thrive, what happens? They become dysfunction. And what is a cancer cell? It's literally a state of dysfunction, and it starts to proliferate and to change. And that happens in many different areas. And so, talking on the topic of cancer and utilizing ozone therapies for that, and other modalities. I think high-dose vitamin C is a tremendous treatment to be able to help somebody with cancer. I think ozone therapy is a tremendous treatment to help somebody with cancer, because it's not about eradicating the cancer. It's about getting your body to be strong enough, to have an immune system strong enough to defeat what's actually happening. And I say that very strongly and passionately because cancer is only detectable by the tests that we currently have. And, by the time we find it, sometimes it's too late. And that doesn't mean that because you had cancer detected on your normal yearly physical visit, that it wasn't there 6 months ago, because it was. We all have cancer cells within our body. It's whether or not they're actually proliferating big enough to actually be there and to be seen by the current tests that we have. So one of the things that I love is actually the proactive approach and helping to prevent things from happening. But then we have the situations where people are coming in and they have cancer. So, why did I use ozone therapy for patients that we saw at our clinic that came in with cancer is because we know that what ozone therapy can do, and there is research on this that actually shows how it can actually increase and balance the immune system. If our immune system is too weak, it's going to actually upregulate that. If it's too strong, it's going to downregulate it. And so it's going to create a balance and homeostasis within the body. And a lot of times when it comes to treatment with that, we would actually do combination therapies utilizing high-dose vitamin C as well. One of the things that I think is pretty amazing is that ozone therapy has actually been shown that if somebody is actually utilizing chemo with their cancer treatment and then implementing ozone therapy as well, that it gives you the benefits of actually boosting the immune system and all the pluses of ozone therapy without having a negative effect on the chemo that's actually being done as well. So it's a great adjunct therapy to be added in. And with that being said, I always recommend that, if you're seeking adding this in, definitely consult with your physician. Talk with your physician about that. And whatever providers are actually working together for this, I've been in this industry enough that there's a lot of clashing heads within this. And one way is going to be the right way, one is going to be the right, but you also have to be an advocate for yourself. as a patient to know what you want. And so I recommend doing the research on it as well. And it is very well documented that ozone therapy can be very advantageous to helping restore the balance within the body, to help boost the immune system, because that's ultimately what you need. Your body needs to have an increase in vitality, increase in that mitochondrial function to help to restore the imbalance that's been happening, which is an underlying reason, such as oxidative stress, chronic oxidative stress, which has been shown to be a leading cause to pretty much every disease that's out there. And I really don't think that truly can be refuted if you truly look at what's happening on a cellular level with cellular aging and degeneration of cells. If somebody were to come to me, and I've actually had friends reach out that have been recently diagnosed with cancer, and they say, where do I get started with when it comes to ozone therapy? And I said, well, the first part that you would want to go to is first you could actually look for a practitioner that actually does ozone therapy in your area. But even before that, you can actually get a home kit. You can actually have a home generator. You can actually do rectal insufflation to have a systemic effect. I know that cancer can develop in multiple areas. You can have prostate cancer, breast cancer. You can have cancer systemically that's having an effect obviously on your body, but the quickest systemic effect that you're going to have is if you're utilizing it at home, would be doing it through rectal insufflation. But if you can find a provider, I think that guidance is always going to be beneficial. Starting with IV infusions would be very, very good for you.